based on our New York City alert levels. Hospitalizations and deaths are stable or decreasing. To assess levels of risk, we look at several indicators, not just cases, consistent with CD recommendations. We're keeping a close eye on the numbers and will continue to let you know what they tell us. At the same time, we know the increase in cases in other parts of the world can be worrisome. While the losses of the last 2 years have been profound, we've also developed tools in that period that are saving lives, including testing, prevention, and new treatments like antiviral pills. Treatment at home with antiviral pills is a relatively new tool in the fight against COVID-19. And it's now more widely available, something that was not true at any other point in the pandemic, including the last wave. Treatment usually works best if you begin it soon after you start feeling ill. So get tested right away and call 212-COVID-19 to get treated. The single greatest tool against COVID remains vaccination. That includes boosters, which we know increases immunity and reduces your chances of getting seriously ill. We need all eligible New Yorkers to get their booster as soon as it's their time, and for many of you, that time is now. Boosters are especially important for those at high risk of severe outcomes and those 65 and older, of which only 55% of New Yorkers have received their booster or additional dose in that group. If you have an older adult in your life and they haven't been boosted, I urge you to help them make an appointment today. The city stands ready to assist anyone who needs help with an appointment. If you have questions, please call us again at 212-COVID-19 or visit us at vaccinefinder.nyc.gov. I should add, it's also a good time to visit with your doctor for a regular checkup or any appointments you may have missed during the pandemic. As a primary care doctor and surrounded by primary care doctors, I have seen, and we have seen, how many of our patients have delayed or foregone care throughout the pandemic, leading to new or worsening health issues. The time to reconnect with your healthcare providers is now. So look, it's an honor to be the city's doctor. Something you'll hear me talk about a lot is the emotional toll that this pandemic has taken on all of us. We have all been through so much over these past 2 years, and continuing uncertainty about the future of COVID can certainly add to the strain on New Yorkers' mental health and well-being. I know that the need to focus on mental health is as important as continuing our fight against COVID. Resources and mental health supports are available, including through NYC Well. We must continue to be there for one another and to get through this together. In addition to getting vaccinated, and for those eligible getting boosted, I want to ask every New Yorker to reach out to someone in your life today to check in or just to share a few words of kindness. Let's rebuild those connections that may have broken down over these past 2 years. The small step can make all the difference in that person's life and in yours. So thank you, and with that, we'll take some questions.
I'll start just going around the room. I think everybody's going to get a turn to get called on. It's a small enough room, so we'll just go around the room. So I'll just start with Emily.
Commissioner, you referenced briefly the variants and the surges we might be seeing in other parts of the world. Is there any indication that they're here in New York City? What level of concern should we be feeling now?
Number one, I just want to, sort of empathize and say that I understand New Yorkers' concern, given where we've been over the last 2 years and successive waves, that rising cases in other parts of the world would lead to anxiety. That's completely understandable. Know that, as we have always done, we are tracking these variants very closely. I think you're referring specifically to BA.2, the Omicron subvariant, and its role in rising cases across the world. I think the important thing to remember and to emphasize for New Yorkers is that currently there is no evidence that BA2 causes more severe illness, increases risk of hospitalization, or that our current vaccines offer less protection against it. But we continue to monitor this, and we continue to stay vigilant.
Thank you.
Matt? Me?
Yeah.
Okay. What benchmarks over what period would need to be met for the employer mandate to fall? And I'm looking for specific benchmarks, not just a generalized answer that you're looking at.
We published a color-coded COVID alert system a couple of weeks ago. And as we showed up earlier on the screen, we're tracking a lot of data, but there are three principal data points that are of highest importance to us. That is cases, hospitalization rate, and bed occupancy rate. This is consistent with CDC guidance as well. And right now we remain in a low risk environment, that data taken together. But I do want to emphasize that our mandates have been among the most important life-saving policies that we've put into place throughout this pandemic, and it's helped us build up a wall of immunity, a bulwark against whatever this virus does to change or may throw at us in the future. So I would love for me to sit here and say I can give you a date or a data point when we would lift those things. Right now, we are in a low-risk environment, and we'll continue to evaluate that.
Do you have any in mind, or it's indefinite?
Any what?
Any level to which it would fall, those three metrics or any metrics, when you would rescind the mandate? Or at this point you have none, it's indefinite?
I think it's indefinite at this point. I think people who have tried to predict what's going to happen in the future for this pandemic have repeatedly found egg on their face, as they say, and I'm not going to do that here today.
And Commissioner, I'd just add, we have many mandates for vaccinations that are for diseases that are very low, including polio and measles, right? Nobody has suggested that we should, because polio levels are so low, we should, say that school children shouldn't be vaccinated for polio. So I think that vaccine mandates have a long and important history in public health.
Well, not for employment, right?
If you want to be employed at my institutions, yes.
Well, employed anywhere.
But the point is, if you have mandatory childhood vaccinations, then everybody grows up to be vaccinated. So it turns out to be irrelevant, right? The point of childhood vaccinations is by doing it at childhood, you're giving the person maximum benefit, and then they grow up as a whole cohort of people who are fully vaccinated.
Carol?
Yeah, Dr. Vasan, could you address the mask situation in schools, whether there's any plan to bring it back if this BA2 gets worse, and also for the children who are under 5?
Thanks for the question. Yes, and I'm aware. I'll start with the last question first. We have consistently seen disproportionate hospitalization rates in the under 5 population compared to other childhood groups. And as a father of a 2.5-year-old and 2 other older kids, I want to keep them as safe as possible. I would love nothing more than to send my son to daycare without a mask. But as a scientist and as a doctor and an epidemiologist, I want to keep him safe, especially because he's not eligible for a vaccine. We're always looking at the data. As I've said, we have very clear benchmarks of how we're assessing risk, and we'll keep reevaluating whether that mandate should stay in place, and right now we think it should stay in place.
Natalie? Oh, sorry.
Oh, this is Natalie. People are just beginning to adjust to this new normal endemic phase. What would a benchmark be if the experience continued to go up, that you could return restrictions and mandates, or what would that look like?
I'm going to sound like a broken record, but I think that color-coded risk alert system provides us with very clear benchmarks. As we showed up on the screen, cases, hospitalization rates, and bed occupancy rates remain the pillars of that color-coded system. There's other data that we also take into account. And I think the wonderful thing about that system is that it is useful for New Yorkers to calibrate their own individual decisions and their own behaviors and their own risk. And it's also very important for us as government and as officials to set policy decisions. So when we're talking about lifting or reinstituting particular mandates, we have very clear tiers of risk, and right now we remain in a low risk environment.
Anna?
Hi. For people who already have the booster shot, is it important to get, or how important is it to get the 4th shot once it's approved?
Right, I think there's been a lot in the press about this right now. What we know is that 2 of the manufacturers have submitted requests for approval to the FDA for a 4th dose, one of them specific to certain high-risk groups and one of them for everyone. As with every other vaccination approval, we're going to be following the guidance and the science from our federal colleagues. And what gives me a lot of encouragement is that we have a vaccine delivery system that can get it out to as many people as possible, as quickly as possible.
Evan?
I had my question already asked,
Oh.
but I'll take the opportunity though. What is the messaging on masks? We have 2 people without, I know you're speaking, but what is the messaging on that to the general public as they go inside public buildings? What is that messaging like?
I think in a low-risk environment, because we are currently there, we are advising New Yorkers to think about their own individual risk, think about their own individual comfort level, think about their own individual conditions and factors in their own life. Remember, we wear masks not only for ourselves, but for our loved ones, our families, our community. And we interact with a whole host of people. So our choices are really need to be calibrated based on our individual comfort level in a low-risk environment where we have currently lifted mask restrictions in indoor settings.
Peter?
Doctor, you talk about the fact that BA2 is not more dangerous. How prevalent is it now, and what concerns do you have about potentially rising hospitalization rates?
I'm going to kick it over to my colleague, Dr. Quinn, to provide further detail, but just know that we are tracking this very carefully through our public health laboratory.
Thanks. Yes, I'll just add, we do a lot of sequencing of SARS-CoV-2 in New York City. We are sharing that information on our website on the variant data page. BA.2 is a sublineage of Omicron, and it has been increasing over the past several weeks. We've been seeing that. At the same time, the overall case numbers have been relatively stable, with some increase in the last few days. So, you know, I think what Dr. Vasan was talking about is that we have seen that BA.2 does not appear to cause more severe illness than other strains of Omicron. It may be a little bit more transmissible, and that's why it is increasing in proportion to the other circulating Omicron strains. And so, you know, we'll be watching the cases, hospitalization rates, and this impact on our healthcare system as we look at the alert levels going forward.
How prevalent is it now?
Our most recent data shows that we're around 30%, and that's also similar to what CDC's data is showing, and their prediction for this week for this region.
I just want to think, the initial Omicron strain was not more dangerous, but the hospital patient count went up. So is there a concern the same thing will happen?
I think that what we showed through the Omicron wave, through the work of Dr. Katz and our colleagues at H&H and throughout our hospital systems, is that our healthcare systems were prepared for those rising cases, that they had adequate supplies and staffing and occupancy. I'll kick it over to Dr. Katz to add more color to this answer, but again, whatever this virus throws at us, I think we're in a much stronger position than we've ever been in the 2 years of living with COVID.
Yeah, I would just add, Commissioner, that as you described, the availability of the monoclonal antibodies and the antiviral drugs is much better now than it was when we were going through the cycle of Omicron. You'll remember that we had almost none of the monoclonal antibody that actually worked against Omicron. While now we have good supplies of that, and we're able, for anyone who gets COVID, as the Commissioner said, if you call 212 COVID-19, we will be able to connect you either by phone or virtually to an emergency room doctor at health and hospitals will be able to arrange for you to get either the antiviral pills or a infusion of monoclonal antibodies. And so that is a level of protection that we did not have with Omicron in the January.
I have a follow-up on that. I'm curious because I spoke to Dr. Varma, who's the senior advisor for former Mayor Bill de Blasio, and he had said some of the testing that's coming up for people who are getting this specific variant, if they're triple vaxxed, they're taking the test, their tests are coming back negative while they have full-blown symptoms, and then once their symptoms are subsiding, that's when the tests are coming back positive. And so I was curious if you're seeing, with the prevalence of some of the at-home tests, are you getting data that indicates that people are not feeling well to kind of like shift how you're responding? And then on top of that, like, is there a concern that the current at-home tests that are on the market are maybe not calibrated well enough for a more vaccinated population and for this specific subvariant?
I have not heard that, and in fact, the people that I know, both my patients and family and friends, have all, when they've gotten symptomatic, tested using home tests, and they've been positive, and that's very up to date. So I have not. I mean, every test has mistakes. Every test in medicine has mistakes. There are people we know who are negative for the home tests and are positive when they have PCR, but that's not even necessarily a mistake. That may just be many more viral particles are needed for a positive home test, and so they may not be that contagious. But I have not heard anything about a specific I don't know.
I'm anecdotally hearing it over the last 2 weeks,
Yeah.
so it seems like it's, but again, like it's a small case.
Yeah, my
count,
experience
right?
was definitely over the last 2 weeks. So
It may be too early to tell, but we do encourage any New Yorker with active symptoms who's testing negative, feel free to go get a confirmatory test. Feel free to go get a PCR. We have plenty of H&H, T2
Absolutely.
testing locations still running. Go to your healthcare provider, go get a primary care visit, and get tested through your primary care doctor and reconnected with care.
Andre, did you get what you need?
No, I didn't get to.
Okay, Andre.
It's a variation on a question that we already asked, but a little more specific. The city health department shows only 36% of the population is boosted. Meanwhile, Moderna and Pfizer are asking for a fourth shot. How much emphasis is New York City putting on making sure people get a boost before the city starts even worrying about a fourth shot?
It's essential that New Yorkers go and get boosted when they're eligible. We know very clearly that getting boosted increases to longer term and higher levels of immunity, reduces the risk of severe illness and hospitalization.